today is a very important class for those of you who are exam going. Yeah, long time no see. Been a while since I took a live sessions, but now going forward, we are gonna have a lot of classes. So all my time now is for you guys. So we'll start off with this class, extremely important for a last moment revision for exam going students. So do revise this, and I'll also tell you the important areas that you should see. What are the classes you should revise from our app? Okay, so we'll talk about all of that. So a brief orientation. Yeah, CNS infections I'll upload. Give me uh, 4 more days until Diwali, and I'll just finish that and I'll upload it. Okay, skull X-ray views. Okay. All right, I can do that. I was planning to have somebody from radiography, teach you about the position of X-ray. So I'll do that. Thank you. I also felt like Spotter book is, like a one-stop shop. We never had something like that. Even Aunt Minnie has a lot of good spotters, but not all in one place. One more book, I don't know how to find spotters for one more book because whatever I thought was important, I've included. So literally the reason for one more book is what are the images that you want to include. You can't revise so many, right? So it's spotters मतलब फिर तो वो radiology हो गया, all images. So spotter you want to remember, right? Thank you. Thank you so much for the appreciation. I was very worried that you guys have waited for so long and then you're going to be like, oh, this is what we were waiting for. I'm just relieved that you guys like the quality and what there might be a few mistakes. If you find them, do let me know, I'll correct them. Okay, if you're not received, just reach out to the customer care, right? I am not the right point of contact for that. Okay, so that's what you want to do. Okay, chalo shuru karte hain. So the agenda for this session is predominantly exam goings, right? So please answer all of these questions. What are usually the things that are kept for table viva? So most important is contrast media. My suggestion to you would be, if they ask you to choose anything out of the given instruments, go for contrast media. They are contemporary, you would have used it, and be prepared with contrast media. Don't pick up this category because this is what you have not seen in your lifetime, but your examiner, who must be an old fellow, would have worked with these, so you can't compete with that. Okay, so never uh, pick up any of this unless asked to, except maybe X-ray tube, because there you have clear cut questions that you can answer. When I had given my viva, I had picked up the X-ray tube, so I had picked up a contrast media, so I think MRI contrast media, and then I picked up the X-ray tube. I think these are the safest. Okay, we have never seen a conventional film or a screen. We have never seen a CR plate. So it's difficult. If you've done them, that's great. But at AIMS, we had never seen any of it. So it's kept actually in table viva. They have this only one existing CR plate, one screen, and cassette, which they keep only for viva purposes. So just be very careful in picking these up. Grid is also a good choice. Beam restrictor also good choice, but stay away from these, okay? Because you wouldn't have done these. TLD batch, very, very good choice to be picked up. Ultrasound gel, stay away because then they can go into ultrasound and we don't want that. Drugs used in radiology, very, very important. I'll talk about this. Is not given in any book. So what I'll be teaching you is very, very important. IR instruments, I am not covering in today's class because they've been extensively covered. What you should do as a follow-up to this class is see those instrument class by Dr. Aisha. She's done an amazing job. Plus, what else you should see after this class are the barium sessions. She's also done, I think, 4 sessions on conventional radiology. Those are very, very good sessions. And Dr. Nikita has taken 2 on barium spotters. For table vive, at least see these 6 sessions from conventional radiology. All right, so that is what you should follow it up with as far as Viva is concerned and IR instruments are concerned. Apart from this, in a table Viva, they can also ask you about PCPNDT, AERB guidelines, and radiation protection. So we have also done sessions on radiation units, PCPNDT protection. Please see those as well. Radiography techniques, meaning how to acquire different kinds of X-rays, is what I will try and get a radiographer or a radiography technician to take it, because they would be the best people to teach you how to acquire different x-rays. So I'll try and do that before your exam. And you should be carrying your thesis. You should obviously know your thesis extensively, because that's a pet question. They'll ask you what you have done. If you can't answer that, that's a very, very bad thing. If you can't answer what you've done, you should be thorough with every single thing: sample size, analysis, results, everything, review of literature, सब कुछ पता होना चाहिए about your thesis. All right. So this is what you have to keep in mind for table Viva. So let's start. I'm going to start with radiography instruments, then contrast media, and then the miscellaneous stuff. Okay. Not covering IR instruments here because that's been covered very nicely. Okay. So tell me the category of what you see. All right. You guys have to answer. You are my students of, and I'm your examiner who will also tell you answers. So tell me first, what do you think this category represents? What are you going to tell? Good. So these are beam restricting devices. So that is what you have to start with, that these are beam restricting devices. The very word tells you that we are limiting the field of the X-ray, right? So we are controlling the exposure. We are reducing the exposure to the patient, and we are reducing the scatter radiation. Let's just talk about scatter radiation here. There are two things which decrease scatter radiation. One are the beam restricting devices and one are grids. So we are going to be talking about both of those. So let me first talk about scatter radiation as a topic, because that's what they will ask you about. So scatter radiation, tell me what contributes to scatter radiation, which effect, what interaction of X-ray with matter contributes to scatter radiation? Very good. It is Compton scatter, isn't it? So this is the Compton effect or the Compton scatter that contributes to the scatter radiation the most. It is dependent on three factors. Can you tell me what does scatter radiation depend on? One, it is the field size. Okay, I'll only tell you. One, it depends on the field size. Very good. Second, it depends on the KVP. Third, it depends on the thickness of the part. Now, we can't control the part thickness. We want to control part thickness, but we can't a lot of times, right? So part thickness is something we will not be able to change. KVP is something we can regulate. So higher the KVP, higher is the scatter. Higher the field size, higher the scatter. Higher the part thickness, higher the scatter, right? So yes, we can decrease the part thickness to a certain extent by compression. Yes, but otherwise, this is something which we will not be able to regulate, but we can regulate KVP, we can regulate field size. So this is what we are trying to tackle with beam restricting device, right? We are decreasing the field size. Okay, so did you understand that all of these are directly proportional to the scatter radiation? What does grid do? Now, grid is basically preventing the oblique rays from going. When we use a grid, and we'll talk about it, it's only allowing the parallel rays to pass through, hence absorbing the oblique rays. So grid also reduces scatter radiation, but grid does it at the expense of higher patient dose, because now more rays will have to pass through the grid in order to expose the patient enough. Yeah. So only two things for scatter radiation you want to remember: beam restricting and grid, and sometimes compressor, right? We use abdominal compression for that, and we can increase KPP. So this is about scatter radiation. Fine. So now going back to beam restricting devices. So this is the purpose here. So we can see three kinds of beam restricting devices. Can you name what is this? This will not be kept in the Viva. It's just a sheet of metal with a hole in it. What is this? Good. This is what is an aperture diaphragm. Very good. So this is an aperture diaphragm. All of these beam restricting devices, they are made up of lead. Okay. So this is what is nothing but a lead sheet with a hole in it that we put into the X-ray tube, and that is what is going to come out. That's what is going to allow the rays to come out. So this is nothing but an aperture diaphragm. Then what do you see here? You see two things. One is a cone and one is a cylinder, right? So what is this? This is a cylinder, whereas conical is the cone. Can you tell me which is better out of cone and cylinder, and why? So what you can see here is a cylinder again, right? So this is a real life image of a cylinder. Cone is better. Everybody's saying cone is better. Why? Why is cone better? So what you want to remember is the concept of penumbra, right? So it is the penumbra which is the answer. So look at this. So what you can see here